When logging into MemberXG, the first page you'll see is called your dashboard. Your dashboard has links for your information, Document Center, and if it's time for you to enroll in benefits, a link for enrollment. During annual enrollment, you can click on Document Center to review your annual enrollment benefit guide. To enroll, click the enrollment icon. On the Enrollment Welcome page, you'll see any active enrollment periods listed. If you have multiple periods, you should complete all available to make sure you are enrolled in the benefits you would like to be enrolled in. In this example, our participant is enrolling as a newly eligible participant with benefits for November 1st through December 31st, 2018. Click the link to begin the enrollment. Now you'll see the terms and conditions of your enrollment. Review this information, then click Accept and Continue. You and any dependents you have added on the plan will be shown on the Family Members page. Review your information, such as your address, to make sure it is up to date. To update information, click the blue pencil icon under Edit. This page is also where you will add any eligible dependents you would like to enroll in coverage. If you do not add them on this page, you will not be able to enroll them in coverage. Click the green plus sign to add a dependent. Fill in your dependent's information on this next page. Fields with a red asterisk are required. You must also provide a Social Security number in order to add a dependent onto coverage. Please note, the plan office requires legal proof of dependency documentation for all enrolled dependents. This can include a birth certificate, marriage certificate, or other documents detailed in your benefit guide. No benefits coverage will be provided until this documentation is received and processed. You can upload these documents securely through the Document Center for faster processing once you have completed your enrollment. Once you have added any dependents you would like to cover on the plan, click Save and Continue to move on. Next is your LiveWell assessment. If you completed your health screening and are eligible for a better program, you must complete the LiveWell assessment to enroll in this program. The LiveWell assessment asks you to provide your primary care physician's name. Click Next after you have entered this information. Now you will answer questions regarding your spouse's current medical coverage. If you do not have a spouse or are not adding a spouse to medical coverage, click the Not Applicable option. If you are enrolling your spouse in coverage and your spouse is employed, they must enroll in their employer's offered coverage first to be secondary on the plan's coverage. If they are employed and not covered, type in the reason they are not covered in the box below. Again, if you are not married or not enrolling a spouse in medical coverage, you may choose the first option and move on. Click Next to move on to the next page. Now you'll select your benefit elections. First, you'll choose your coverage for medical. The bundle election shows you which programs are available to you. Click each program to see what benefits are offered by selecting this program. In this example, the participant chose the Standard program, which includes medical and prescription benefits. Next, select your coverage type. This is your coverage level. Because of this participant's months in the plan, they are not eligible to enroll a spouse in medical, but can enroll eligible children. After you select your type, the dependents who will be covered are shown in the eligible family members box. You will also see the cost for coverage displayed in the premium box. This cost is your weekly payroll deductions. Click Next once you have selected your medical program and coverage type. Now you will choose your dental benefits. First, select Dental from the Bundle Election dropdown. Next, choose your coverage type. Again, as you choose your coverage level, the dependents in the Eligible Family Members box will update to show who will be covered by dental, and the premium will change to show your weekly cost. Click Next when you have chosen your dental coverage type. Now you must choose your beneficiaries for your life insurance and accidental death and dismemberment benefits. If you are completing your annual enrollment, you may already see your previously chosen beneficiaries listed on this screen. You may update their information or change your beneficiaries if you would like to by following the directions at the top of this page. If you are new to the plan, you will have no beneficiaries listed and must add at least one. Click the green plus sign to add a beneficiary. When adding a beneficiary, you can choose from your family members listed at the beginning of your enrollment, or you can add a new beneficiary. To choose a family member you have already listed, click the bullet next to Select from List and choose your dependent. Their information will populate in the fields below. Then select their type, primary or secondary, and choose the distribution amount. Your total distribution must equal 100% for each type. To add a new beneficiary, fill in their information. Fields marked with a red asterisk are required. Anytime you enter an address in the site, you may see this box pop up if you have entered something incorrectly. Review the options, then choose Revised if it is the correct address. In this example, our participant only entered 50% distribution for primary and 50% distribution for secondary. Because of this, clicking Next caused an error. To edit, click the blue pencil icon. In this example, we'll change both to primary. Now that we have the correct distribution percentages, we can click Next. On the next screen, you'll enter a valid phone number. This should be a number that the plan office can reach you at in case they have questions regarding your enrollment. Select if this number is a mobile number or a landline. You may also indicate if you would like to receive text message updates in the future. This can be reminders about enrollment or other important plan information. Choose your preference, then click Next. This brings you to your enrollment summary. This page shows you what program you elected as well as what coverage levels. Your total weekly payroll deductions are listed. The Covered Family Members chart shows which members of your family are on your coverage. In this example, you see that Jack Doe is not covered for the standard medical program, but is covered for dental. You'll also see your elected beneficiaries. If this information is correct, click the blue Submit Enrollment button. Then select Yes. Your enrollment is not completed until you select both of these buttons. Congratulations, you have now enrolled in benefits through the MemberXG portal. An enrollment confirmation is automatically sent to your email address. You may also select the blue printer icon to print a copy from this screen. As a reminder, if you've added dependents or if you have medical coverage for a spouse previously enrolled in the plan, you need to submit the required dependent documentation in order for your dependents to have coverage. Please refer to your benefit guide for more information on dependent documentation. You may submit this documentation by clicking on the link for Document Center, then clicking Upload. If you have any questions or need any assistance, please contact the plan office at 502-423-8533 or toll free at 800-451-9545.